Okay, hopefully everyone can hear me. Dr. Griffin has set the stage for me to talk about another important piece of the Salmonella story, and that is applies to contamination and the trends that FSIS has seen in raw poultry over the last 20 years or so. Okay, so I'm going to start with this graph. I think we've all seen this or are familiar with this. It shows the incidence of Salmonella infections from 1996 to 2019 within food net and catchment sites. And yes, it's clear that the line here is nearly flat. We've seen very little evidence that Salmonella incidence has improved over time. So with this backdrop, within, I guess, the last couple of years, FSIS has been concerned about it. And that has prompted us to really sit and ask ourselves some really important questions. So I'm going to be talking today about the result of some analysis we've done to better understand Salmonella trends in our regulated products, given this disappointing trend in illnesses. And like I said, you know, the incidence curve there is prompted us to ask questions specifically about meat and poultry. We do know that meat and poultry are known sources of Salmonella infections. This chart, which is taken from the 2018 IFSAC annual report, shows that the fraction of Salmonella infections attributable to chicken and turkey combined is about 21%. So that's not a paltry fraction at all, but we shouldn't lose sight that there are other sources, including produce, that are also contributing to the overall picture of illness. So these are the questions that FSIS recently sought to answer. What is the trend in Salmonella contamination in FSIS regulated products since the late 90s? When FSIS began implementing its landmark PR HACCP final rule. And secondly, we wanted to know how this trend in contamination compares to illness trends. So really quick background on PR HACCP rule, the pathogen reduction / hazard analysis and critical control point final rule was published in 1996. And then from 98 to 2000, implementation began in phases, starting with large establishments and ending with very small. With the rule of meat and poultry processors were required to develop and implement HACCP plans for preventing and controlling foodborne hazards. And in turn, FSIS's responsibilities shifted more towards verification. And with that meant that product sampling would become a big part of what we would be doing. So today, sampling is a key component of FSIS's pathogen reduction strategy. Every year, we collect about 100,000 samples for pathogen testing. This supplies us with a continuous stream of information about contamination in our regulated products. When inspectors collect product samples at establishments and send them to our laboratories for testing, the data that is generated allows us to do a number of key things, including conduct baseline surveys to estimate industry-wide prevalence. For LM and STEC in selected products, sampling allows us to prevent adulterated food from entering commerce. We also conduct surveillance to identify foodborne outbreaks and monitor antimicrobial resistance. And most importantly, we assess establishments against performance standards using the data collected from verification testing. I'll now say a few things about pathogen reduction performance standards, which is another important tool we have when advancing our mission. FSIS has set standards for Salmonella in raw meat and poultry since 1998. The process for developing these standards has evolved over time. Our current approach to setting standards factors in multiple variables, including industry prevalence and healthy people goals. Performance standards are useful to the agency because they allow us to verify establishments are consistently controlling bacterial hazards. Those that are not controlling these hazards consistently are subject to follow-up sampling and may be subject to other FSIS follow-up actions, including food safety assessments, which basically is an in-depth verification process that allows us to see if there are design flaws in the food safety system, non-compliances that might have been missed, that might be contributing to process control failures, and so on and so forth. FSIS also uses market pressure to positively influence industry by categorizing how well each establishment is meeting the performance standards and making this information publicly accessible. This information can and does influence purchasing decisions. So to assess trends in salmonella contamination, we looked at data from two sources: baseline surveys that, again, as I mentioned, we use those to estimate national prevalence of salmonella in a number of FSIS regulated product classes. And then we also used verification testing data from 2000 to 2018 in the same product classes associated with the baseline surveys. And these products included young chicken carcasses, ground turkey, and ground beef. So this basically illustrates what we found when we analyzed this data. This slide shows the percent change from baseline for each year's worth of verification testing for chicken carcasses, ground beef, and ground turkey. While the y-axis is percent change, just keep in mind that values are expressed in the negative so that you can interpret the curve intuitively. Overall, we see a downward trend in salmonella contamination for all three products that we looked at. So now I'm going to call your attention to a few blips in this graph. The blips have meaningful stories behind them. In 2013 and 2014, there were sudden spikes in contamination for ground beef and ground turkey. The apparent increases in positives was an artifact of increasing the sample volume for each of these products from 25 grams to 325 grams, which led to greater recovery in the lab. But what's interesting is you can see that soon after these upticks, we saw a return to declining contamination. And that's because the industry responded to the data that we reported. In 2016, chicken carcasses showed a big spike that corresponded to FSIS moving to a new neutralizing broth as a transport medium. Unlike the previous broth that we used, the new broth contained a buffer capable of counteracting residual carryover from chemicals applied during processing. Moving to a new broth improved our ability to detect salmonella on carcasses, so that's why we saw such a big spike in such a short period of time. As with the other products, soon after we saw this spike, positives again started to decline as the industry responded to the pressure we put on them. So now I'm going to call your attention to other developments that also map to this graph. In 2010, FSIS started posting establishments by their performance standard categories, thereby using market pressure to drive down contamination. And you can see the effects of this action in the years afterwards. A pretty steep decline was seen between 2010 and 2016. But also notice the steep decline from 2006 to 2008. That is when FSIS announced its intention to begin posting establishment categories online. We have good reason to believe that even when we just propose an action, the industry is responsive and starts to clean up so that it's prepared when implementation finally occurs. And this graph bears that out. So what do we conclude from all this? Starting with the first question we asked earlier, What is the trend in salmonella and raw poultry over the last 20 years? Well, we saw a substantial reduction in contamination relative to the baselines. We also saw that, chicken carcasses and ground products, overall, we saw greater than 60% reduction, despite seeing significant increases in our sensitivity due to increased sampling volume and improved recovery by switching to a new neutralizing buffer. So that's pretty remarkable. The second question is, how does this trend compare to human illness? And unfortunately, we can't say that we see a parallel decline. The product contamination rates have decreased, but illnesses have not. So we looked for supporting analysis. We wanted to make sure that what we are seeing in FSIS's data is backed by something else. And so we looked at NARMS data, and Patty mentioned the retail FDA data as well. So we looked at that data and looked at trends over pretty much the same time period that we looked at the FSIS verification testing data. And what we found was that bottom line is FSIS and NARMS data tends to be in agreement from 2010 to 2017, both showing a reduction in salmonella contamination in all products. The exception is in pork. FSIS does not have a lot of verification testing data for pork because we only started doing exploratory sampling for that particular product class within the last few years. And so we weren't able to include that in our analysis. But when we looked at the FDA data, we did not see a decline in the pork chops contamination. And I've noticed is that pork is one of the few regulated commodities that is not subject to a performance standard currently. So the takeaways, okay. Net decrease in salmonella contamination in almost all raw commodities since 1998. So that's really, really good news. And this is evidence that performance standards have shown some effectiveness in reducing contamination. We attribute this progress to multi-sectorial efforts. It's not just an FSIS accomplishment in the slightest. We thank our federal partners, CDC, FDA, APHIS as well. State and local agriculture, public health partners, and academia have also played a role. The FSIS regulated industry clearly has been responsive to new policies that we've put out. And retailers, they have been responsive to the posted categories. When we categorize establishments based on their performance standard, performance, they are responsive to that data. So it's been a team approach, definitely. But the job is not done. Static illness incidents suggest more work is needed to reduce pathogens, and that includes meat and poultry. Science is key. We need new science to address food safety questions that just remain persistent, that are recurring, and we haven't yet gotten answers to. With increased technology, we do have more opportunities, and we should not be afraid of leaning into those opportunities, take advantage of innovation. And we look forward to building strong partnerships and collaborations to influence that, and we hope to be successful. So I thank the working group for considering this very important topic, and I'll take any questions.
Thank you very much, Dr. Robertson-Hale. And this is open for questions. And again, I'd ask that only committee members of the Salmonella in Chicken Committee. And I see we have a question from Sarah Sorsha. Please go ahead.
Yeah, I was, thank you both for these are terrific presentations and very informative. I was struck by how much Dr. Griffin's presentation focused on serotypes. And obviously the performance standard that FSIS uses looks at prevalence overall. And I'm just wondering if you could speak to the any work that FSIS has done to identify serotypes and communicate about those with industry, and what's your impression of the response that you've gotten from that?
Yeah, so we do a characterization of all of our Salmonella isolates, and that includes serotype. And then at the strain level, using WGS, we do we do antimicrobial resistance testing. So we have made a point of communicating that information to industry to help them when they look at their HACCP plans, take into account serotypes and strains that have been linked to illness or associated with illness. And right now, within the agency, we are trying we are considering ways that we can look at Salmonella in a more granular way when it comes to our policies. We are definitely open to changing our approach on that, as long as we have a strong scientific foundation for doing so. So I think it's a valid point, a valid question to put out there about looking at serotypes and other sub divisions of Salmonella to maybe look at a more risk-based approach. And that's something that we, like I said, are considering.
Patricia Griffin asked if you could provide data on contamination of chicken parts, so that you provided data on carcasses.
Yeah, that's also a good question. Just for background, we did not start doing chicken parts sampling until, I'm going to say 2012 or 2013, around that time. So for this analysis that I presented, we tried to look at, over the last 25 years or so of trends. So yeah, I think that would be a good next analysis. And I actually think we have looked at chicken part trends, and so I think that will be a good thing for us to share in future meetings if the work group is open to seeing that.
Do we have any additional questions? Okay, well, thank you very much for your presentation. Moving on then, the next section.
Oh wait, I'm sorry, Isabel, I've got another one from Patricia. She just sent in the chat box. It says, any data on level of contamination?
All right, so you're talking about enumeration of Salmonella in our regulated products?
I'll have to let Patricia answer that one.
Yeah, I'm not a committee member, so I'm not speaking up, and I just sent a message to Jessica in case she wanted to ask that question. That's what I was talking about. I know it's not something you can do routinely, but it's something people are talking about, and I'm wondering if there were any scientific studies.
Yeah, that is something that we're also looking at in terms of methods. I don't think right now we're ready to implement an enumeration strategy, but we're not against it. I think the science, we just need to look at what technology would allow us to do that with the resources that we have. But it's one of our research priorities is to identify a method that would allow us to do that and still be fit for purpose. So yeah, I mean, it's a good question.